What if the blood pressure number you've worked so hard to reach isn't actually the safest one? That was the question Robert never expected to ask. At 72, he was thrilled when his doctor said his blood pressure was finally under control. He thought he'd won. But within weeks, something felt wrong. Every time he stood up, the room seemed to spin. One morning, he nearly lost his balance and grabbed the kitchen counter just in time. Instead of feeling healthier, he felt less confident than ever. So what happened? Was his blood pressure too low? Or was something else going on? Research shows that controlling high blood pressure can reduce the risk of heart attack and stroke. But it also suggests that treatment isn't one size fits all. Your age, overall health, medications, and how you actually feel all matter. Before deciding what your ideal number should be, let's look at what changes inside the body as we grow older. The answer may surprise you. The answer begins inside your arteries, the blood vessels that carry oxygen-rich blood throughout your body. When you're young, they're flexible, expanding and relaxing with every heartbeat. Think of a new garden hose. Water flows through it easily because the walls are soft and flexible. As the years pass, those walls gradually become stiffer. Blood can still move through them, but it takes more pressure to keep everything flowing smoothly. That's one reason blood pressure often rises with age. But growing older doesn't mean high blood pressure should be accepted as normal. Persistently elevated readings are still linked to a greater risk of heart disease, stroke, and kidney problems. That's why doctors don't focus on age alone. They also consider your overall health, medical history, medications, activity level, and how you feel from day to day. Remember Robert? His numbers looked good on paper, yet his body was telling a different story. So if blood pressure naturally changes as we age, does it really make sense for every older adult to chase exactly the same target? For years, many people have believed that every older adult should aim for a blood pressure of exactly 120/80. It sounds simple, but the human body rarely follows simple rules. While 120/80 is considered a healthy reading for many adults, it isn't the perfect goal for everyone. A healthy, active 70-year-old may have different needs than someone in their late 80s living with several medical conditions. Frailty, which means reduced strength and a greater vulnerability to illness or falls, also changes the picture. Doctors look at much more than a single number. They consider your heart health, kidney function, medications, balance, daily activities, and overall quality of life. That's why modern treatment focuses on the individual, not just the blood pressure monitor. Think back to Robert. His reading looked ideal, yet he didn't feel well. That raises an important question. Can blood pressure become too low for certain older adults? The answer may explain why chasing the lowest number isn't always the smartest strategy. This is where Robert's story starts to make sense. For some older adults, blood pressure can become so low that the body struggles to deliver enough blood to the brain when standing or moving quickly. The result may be dizziness, unusual fatigue, blurred vision, or feeling unsteady on your feet. In some cases, it can even lead to fainting or a serious fall. These symptoms aren't normal signs of aging, and they shouldn't be ignored. That doesn't mean blood pressure medication is dangerous. In fact, treating high blood pressure remains one of the most effective ways to lower the risk of heart attack and stroke. The goal isn't to stop treatment. It's to find the level that's both effective and safe for you. If you've noticed new dizziness, weakness, or repeated falls, don't adjust or stop your medication on your own. Speak with your healthcare provider instead. They can review your symptoms, check your medications, and decide whether changes are needed. So where is that balance? What blood pressure range offers protection without creating new problems? The latest research provides a surprisingly thoughtful answer, and it isn't based on one perfect number. Over the past several years, researchers have learned that the answer is more balanced than many people expected. Large clinical studies consistently show that treating high blood pressure can reduce the risk of heart attacks, strokes, heart failure, and other serious complications. That's why most modern medical guidelines encourage keeping blood pressure well controlled whenever it can be done safely. But there's one word that makes all the difference: safely. Today's doctors recognize that healthy aging doesn't look the same for everyone. Instead of chasing one universal target, healthcare providers consider the whole person. They look at your age, medical history, medications, kidney and heart health, physical activity, and whether treatment is affecting your daily life. They also pay attention to symptoms like dizziness or frequent falls. Even home blood pressure readings often provide a clearer picture than a single measurement taken in a medical office, where stress can temporarily raise the numbers. Remember Robert? His story wasn't really about finding the lowest blood pressure possible. It was about finding the right blood pressure for him. That's the real goal of personalized care. And while your healthcare provider helps determine that target, the choices you make every day can have an equally powerful impact on your heart and overall health. The good news is that some of the most effective ways to support healthy blood pressure don't happen in a doctor's office. They happen in your everyday routine. Start with your plate. Eating more vegetables, fruits, whole grains, beans, lean proteins, and healthy fats can support both your heart and your blood vessels. Cutting back on heavily processed foods and excess salt may also help many people keep their blood pressure in a healthier range. Movement matters just as much. You don't have to run marathons. A brisk daily walk, gentle cycling, or light strength training approved by your healthcare provider can strengthen your heart and improve circulation. Good sleep is another powerful habit that's often overlooked. When sleep suffers, blood pressure can become harder to control over time. Managing stress also plays a role. Simple activities like deep breathing, gardening, reading, or spending time with loved ones can make a meaningful difference. If you've been prescribed medication, take it exactly as directed. And check your blood pressure at home with a reliable monitor, keeping a record of your readings over time. Small, consistent habits usually outperform quick fixes. But even healthy routines have limits. Sometimes your body sends warning signs that should never be ignored, no matter how well you're taking care of yourself. Most blood pressure changes happen gradually, but some symptoms demand immediate attention. If you suddenly experience chest pain, severe shortness of breath, a crushing headache unlike any you've had before, weakness or numbness on one side of your body, trouble speaking, confusion, vision changes, or fainting, don't wait to see if they pass. These could be warning signs of a heart attack, stroke, or another medical emergency where every minute counts. Acting quickly can improve treatment options and may reduce the risk of lasting damage. Even less dramatic symptoms, especially if they're new or becoming more frequent, deserve a conversation with your healthcare provider. Listening to your body isn't a sign of fear. It's a sign of wisdom. The sooner problems are recognized, the better the chance of protecting your health and independence. And that's exactly what this journey has been about from the very beginning. Making informed choices that help you age with confidence. The most important lesson isn't to chase a perfect blood pressure number. It's to protect your health, preserve your independence, and enjoy the years ahead with confidence. The best blood pressure target is one that's based on research, personalized for your needs, and guided by your healthcare provider. Like Robert, you may discover that the right number is the one that helps you feel your best, not simply the lowest one on the monitor. Stay curious, keep asking questions, and make healthy choices one day at a time. If you found this video helpful, please like, subscribe, and join us for more evidence-based tips to support healthy aging.